Good morning, I'm Gavin Nimon from Orthopedics and I'm here to tell you about arthritis. Arthritis is a common presentation to my practice, especially in the older patients who present with pain which started out of the blue. Generally, patients believe that all arthritic pain should start just slowly and develop with time. However, really, sometimes arthritis can present in a sudden fashion. They may twist their knee or suddenly knock their shoulder and suddenly develop pain. And believing it could just possibly be a loose body or something catching in the joint, they come for a presentation. But it may often just be the first presentation of an arthritic joint. So it doesn't always have to start slowly, it can start after a sudden traumatic episode. There are two types of arthritis, main groups. The main one, which most people know, is the osteoarthritis, which is the wearing out of the joints. The other type of arthritis is an inflammatory arthritis, of which the most common type is rheumatoid. This includes things like psoriatic arthritis, which is an arthritic condition associated with a skin condition, or other different various forms of arthritis. This is less common, but is often treated by the rheumatologist with anti-inflammatory medications and can do quite well. The osteoarthritis, which is the wearing out of the joints, is the main one that presents to an orthopedic surgeon. It's the most common one for which most patients will have a joint replacement eventually. What is the osteoarthritis? Well, it's a wearing out of the joint. The joint can, all lubricating areas such as a bearing in a car engine or wheels on a caster on the supermarket trolley will wear with time as they move. The same thing occurs inside a joint of the body. The bones which make up the joint of the body, and we look at the knee joint here, the bones will have a lining on the end of the bones called hyaline cartilage. And this is a soft, impact-absorbing, lubricating substance that lubricates the joint and naturally allows the joint to move nice and freely. With time, all substances in the body degenerate and the body has its own repair mechanism. At a young age, as things damage, the body repairs itself, but as we get older, the repair mechanism isn't as strong, and therefore the actual wearing out process takes over, and slowly the knee joint wears away or the shoulder joint wears away. There are things that can speed up the process. First of all, if there's been a traumatic episode, if someone's broken their joint or broken the bone near the joint and it's led to deformity, that can lead to a wearing of the joint even quicker. Also, there can be, if there's been other factors such as an infection in the joint, can damage the joint surface and cause it to wear quicker. And of course, some patients are just unlucky in their genetics. They're more prone to arthritis, while there are other patients who are very lucky and never get arthritis, no matter how much stress they put through their knees or their shoulders. There is occasional factors that can actually hasten the development of arthritis, and these are factors that a lot of people don't like to think about, but the most common one is something like smoking, which actually damages the actual repair mechanism and also the actual surface of the hyaline cartilage as well. And so therefore smoking is a very important thing to avoid to reduce the risk of arthritis. It is also a factor that can be initiation factor for rheumatoid arthritis, some people believe. Once you get arthritis, what's the treatment? Well, really it depends on the symptoms. The main symptom which people present with arthritis is pain. They may present with pain in their knee, or in their shoulder, or in their elbows, wherever the arthritic joint is. A very common one is actually in the base of the thumb. And if the pain isn't severe, and if the patient can tolerate the pain, just being aware of what the condition is, being told of what the diagnosis is, can help them cope with it. If the pain is annoying to the patient, then regular analgesics such as a regular Panadol or Panadol Osteo, or other forms such as a stronger one which might include a slight degree of codeine in it. Other factors or other anti-inflammatory medications can also help, such as Nurofen or Voltaren. They're designed to reduce the inflammation around the joint, but really they work as more as a painkiller in this scenario. One needs to be aware that the anti-inflammatories can cause stomach irritation or increase someone's high blood pressure if they're prone to high blood pressure. Also can actually flare up asthma, and so it should always be taken in consultation with a general practitioner. If these measures don't help, then there are other factors that can also help. The more force put through a joint which is wearing out, the more it actually causes symptoms, and therefore weight relief off that joint is important. So you might see a person who's got arthritic knee using a stick in their opposite hand to take the stress off that knee when they're walking. And nowadays there's more trendy type of sticks available rather than the old traditional walking stick that can help. The same applies with the weight the patient's carrying, and it is important to try and keep the weight down, as any extra kilogram carrying on your body weight will actually be magnetised, increasing magnitude as the patient walks, and therefore effectively the knee sees about 10 times that kilogram weight on the knee when it walks, and so every kilogram that's lost will take the stress off the knee. After all those measures though, there are other factors that may help. Sometimes an injection is warranted to try and help down the acute symptoms, and a form of steroid injection is sometimes suggested. There are negative effects of injecting the steroid. It can be damaging to the joint if used long term, and also has a small risk of infection, and therefore is avoided, given it can often give only short-term benefit. Finally, if all these measures fails, then it really falls back on a type of joint replacement, either a shoulder replacement or a knee replacement in those two main structures. Other joints which have arthritis can be treated with simple removal of the inflammatory area, like an AC joint or the acromioclavicular joint. You just have the small area of bone which is rubbing excised. But the main joints require joint replacements. I would refer you to my website for further information about these. AC joint arthritis, knee replacements, shoulder replacements, which will give more specific information to what surgical options are available. In general though, osteoarthritis should be treated with non-operative measures before we go down the path of operative measures. I hope this small video will explain a bit more about osteoarthritis for you. There's more information on my website, but feel free to make an appointment to see me if you have any concerns. Gavin Nimon at Glenelg Orthopaedics. Once again, we'd like to provide quality orthopaedic care to my patients. Thank you very much.